Hi, Dennis. There are a lot of things you've taught me since we first worked together in October of 2005. My very first interaction with you in Halifax was as a medical student visiting from Manitoba, assessing a self inflicted gunshot wound to the flank. In that scenario, and consistently throughout my residency, you always maintained your cool no matter how challenging the operation, how many hours of adhesions needed to be laced, and no matter what the resident or fellow did. Your words of practical wisdom stay with me to this day. You always took the time to get to know your patients, your residents, and your medical students. This is an uncommon strength. As my first program director, you were always supportive and kind. It didn't matter what time of the evening you were there to help, because that was the right thing to do. I hope you have comfort in knowing that you've built and supported the careers of countless surgeons and residents. I will always cherish the times in the operating room, the clinic, driving to and from Windsor, and outside of medicine where your humor and patience speak volumes. Since starting my practice 5 years ago, I have appreciated your experience and help without hesitation anytime I have called. Now I wanted to pass this over to the real Dr. Yaffe for a few more words.
Hi, Dennis. It's Cliff. I just wanted to say a few words to take this opportunity to do that. And the first thing that I wanted to say is that you made my job as your program director in general surgery, and I'm very proud to say that. You made that job very easy. In fact, it was a distinct pleasure and privilege to have you as a resident. You had this amazing ability to take the most complex surgical problem and make it seem so simple and straightforward. You seemed to handle every problem with a no-nonsense and quiet nobility and confidence. And you instilled confidence and trust in all of us as your teacher and me in particular as your program director. And I'm so proud to say that you've excelled in all that you have set out to do. You've made it easy to like you and to be one of your fans and a friend. I've cherished that kinship over the years. And whether it was in Manitoba, in Guelph, in Montreal, or Halifax, you've not lost that ability to amaze people with your straightforward confidence and practical approach. Now, Dennis, when Paul started his residency in general surgery at Dalhousie, I was so happy and relieved to know that it would be you that would be there to teach and to mentor him. And for that, I'm really extremely grateful. And I think one of the most wonderful moments for me in showing on how the teacher-learner relationship can evolve was at the Canadian Surgery Forum in Montreal last year when I attended your hernia symposium, and we were chatting about your approach to mesh repair. And as you were teaching me about your approach and what to do, I was thinking, wow, this guy was one of my residents. He's now one of my teachers, and he's made me so proud. And I understand that you're heading back to your Manitoba roots on the prairies, and I want to welcome you back.